Good morning and welcome to this week's Dr. Murphy Public Health Review series. I hope everyone is doing well today. Happy holidays. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines and a viewer-submitted question through today, November 26th. We welcome any questions and comments down below or at any of our social media linked in the description. Our first story today is around COVID vaccines. A massive study was just published from the VA, the Veterans Affairs Committee here in the US. Can you tell us what they found?
Yeah, this is a great study and very relevant for everyone because the big question now comes up, oh, do I need the COVID vaccine? I've had multiple vaccines. I've had COVID a couple times or this, I don't need the vaccine anymore. So the vaccine uptake is very low, even in people that believe in vaccines. However, the veterans have a very nice centralized database, and they looked at 295,000 veterans. 164,000 had the COVID and influenza shots, and 132,000 only had the flu shots. And the estimated vaccine efficacy was about 30% avoidance of emergency department visits, approximately 40% effective in reducing hospitalizations, and really a staggering 64% prevention in deaths. I mean, this is last year. This is in the United States and U.S. veterans. The data are very clear. You want to avoid the hospital, the emergency department, and avoid dying, take your COVID shot and influenza.
Absolutely. And on the note of those influenza vaccines, we're getting more exciting news about the potential of cell-based versus the older technology egg-based vaccines. Can you break it down for us?
Yeah, for decades, they were making the vaccine in eggs. That was one of the reasons egg prices were so high. All right. But anyway, that was just one of the reasons. Bird flu, of course, was the other one. But anyway, now they can make it just from cells. They can just grow cells and make the vaccine. They can also do the mRNA thing, but that's a different thing altogether. This is just cell-based. They've been working on this for a long time. It's way overdue. And what they found was that the vaccine has greater efficacy by about 20%. So a 20% improvement in the current vaccines would actually translate to a benefit of about it would have averted over 2 million symptomatic flu cases, over 1 million outpatient visits to the doctor or clinic, emergency department, about 15,000 less hospitalizations, 2,500 intensive care unit admissions, and 574 deaths. So it's just a new technology. How to make this without using all those eggs. So it's just it's a step improvement, but it's a 20% effect, and from a public health standpoint, it has enormous consequences if we switch over to this technology, which is likely in process and happening.
Absolutely. Very exciting news from the public health perspective there. And we
Mhm.
received a question this week from a longtime viewer who was wondering if a pregnant woman is vaccinated with, for example, a COVID or a flu vaccine, how exactly does that immunity transfer over to the child? Is it in utero? Is it after birth? How does that work?
Well, it's mostly in utero because the mother who gets the vaccine makes an antibody, and the mother's connected to the baby. And so those antibodies cross placenta and go to the baby. So the baby is born with the mother's antibodies, protecting it from these infections. RSV is the real classic one. You give it in the third trimester because RSV is can be devastating for kids under a year, 1 or 2 years of age. I mean, it can fill up ICUs and hospital beds for pediatrics. So the mother does that. The antibodies are also in the mother's milk. So if she's breastfeeding, they're going to get even more antibodies from that. So it's all the mother helps.
Yeah, all good stuff there, but unfortunately, some sad news out of Washington state over the weekend as we learned that the avian flu human patient had passed away. Can you give us any more details?
Yeah, there's not too many details other than that the patient has expired. So we hadn't heard much about the avian flu in humans. There hadn't been a reported case for many months, and then this case pops up. Now, it's an elderly person with some underlying health conditions who had a backyard flock of domestic poultry at the home, and those domestic chickens or whatever they were did come in contact with wild birds. So they probably got infected from the mixture between the wild birds and the domestic birds, and then the domestic birds gave it to the proprietor here, and this person has passed away. So that's very unfortunate. But this is what happens.
Very unfortunate and still important to know no signs of human to human
Right.
transmission, but public health researchers are
Key
continuing to
point.
look into it.
Key point.
Mhm. Now, a very, very massive study was just published, a systematic overview looking at general infections and cardiovascular disease risk. Can you tell us the results?
Yeah, well, we always wonder, like, why do some people have heart disease? Why is it so common? Why is stroke so common in heart disease? It's genetic, it's diet, it's all this stuff. Well, we've known that these viruses can sometimes affect the heart or the nervous system. And an analysis done by researchers at UCLA, very reputable, published in the Journal of the American Heart Association, also highly reputable. They looked at all the data from 155 different studies, and they found that the infection, this has nothing to do with vaccines, by the way. This is just you get infected, does your risk increase? And the answer is yes. For HIV, the risk for heart disease, coronary heart disease, increases by about 60%. For COVID, the increase is 74%, and for stroke, it's 69%. For the flu, just getting the regular flu was associated with an elevated risk of myocardial infarction, 4 times greater than if you didn't have the flu. All right. And it goes on. Even hepatitis C had about a 27% increase, and even shingles, herpes zoster, was associated with an elevated risk of about 12%. So you don't want to get those infections. If you can avoid those infections, your risk for heart disease, it's just one of the many things you can do to reduce your risk of heart disease. So avoid those infections. And what's the best way to avoid it? Well, there's vaccines or treatments for all of them. So this is a really powerful study.
Very powerful and very important to keep in mind. But something that we talk about a little bit less is hand, foot, and mouth disease, which we're seeing increase in some states. Can you tell us where and by how much?
Yeah, there's been a threefold rise in medically attenuated hand, foot, and mouth disease, which is caused by a virus called Coxsackie virus. And there's been this big jump in the number of cases around the country. And these cases can occur in all ages, but the most common is in children under 5. So if they have like oral ulcerations, hand and feet ulcerations, that's typically how the diagnosis is made. You can, of course, do a blood test to confirm it, but and it's disabling while you have it, but it's generally pretty mild. But the number of cases have just like really skyrocketed lately. There's no vaccine or anything, but just people should just be aware.
Mhm. And our final story today, this time looking at a bacterial infection, is whooping cough. There have been increased cases here in the US, and I understand another death. Can you bring us the latest?
Yeah, no, whooping cough. We didn't see whooping cough for a long time in the United States because there's a vaccine to prevent it, but people are not taking the vaccines as much as they used to. So Texas has reported over 3,500 cases in 2025. In 2024, there were 1,928. So it's a big, big increase. And if you look nationally in the United States, they've found about 6,600 cases in the first 3 months, which is 4 times higher than in 2024 and 25 times higher than in 2023. So what is going on here? Uh, it could be a very debilitating disease. And this third infant has died from whooping cough in the state of Kentucky. It doesn't, it's the mortality rate is low, but I mean, you can still die from it. So whooping cough is a serious childhood disease that's now like measles, is just like taking off. So, we're going backwards in terms of the health in this country, especially in these children that are not taking the vaccines.
Absolutely. Those vaccines are so important. And I'd like to thank you, Dr. Murphy, for your time and your expertise, bringing us all of this important information right before the holidays. So thank you very much.
Well, have a great Thanksgiving to you and everyone that's watching.
Well, thank you so much. And thank you all for joining us for this week's Dr. Murphy's Public Health for You series. We hope to see you back next week. And as always, any questions or comments are welcome down below or at any of our social media linked in the description. Happy Thanksgiving.